Soweto. She joins us now live. Zikhona, the issue of these vast payments being lost by the health department because of medical claims is a big one.
Certainly, Shahan, and we are standing actually at one of the hospitals that has the largest number of complaints coming for medical negligence on the part of Gauteng government. We heard at the Life Estimeni hearings that on certain occasions, government had to fork out 300,000 rand per day for legal consultation fees for medical negligence. Jack Bloom, they're saying most of them do come from the maternity ward in the walls behind us, Michelle. So certainly very concerning because government is losing billions when it comes to medical negligence. Another problem for Gauteng, Michelle, is the fact that the province is in debt when it comes to its health department. We know that this province owes a sum of about 4 billion rand to service providers in the province. The MEC of Health in the province saying that that's attributed to the fact that this province has a very, the population continues to grow here and it's doubled since about 2015. So a lot of people rely on this province for medical care, not only from South Africa, but from the continent at large. A lot of people come here because we are better at providing medical health care, believe it or not. As many South Africans would have you believe that it's actually not good to go to a public hospital in South Africa. But Michelle, one of the biggest causes of death in this country as well is TB. So government's budget has also got to go a lot to fighting the infection of TB. We know that in 2015, more than 30,000 people died as a result of TB. I do have with me Stephen Ngobo from the TAC. They've just recently released a report to say that government is not doing enough to curb the infections of TB, particularly in their facilities. They're saying that facilities are overcrowded, windows are not open, and those are things that could help in fighting the infections or new infections of TB. So I'm just going to give him some time to give us more detail about this report. What are the other concerns with regards to the infections of TB and how government is dealing with them?
Thank you, Zikhona, for this opportunity. I think a treatment action campaign, we are concerned with the lack of strategy, the lack of seeming to care about public care users. For example, just recently, just today in fact for that matter, I had a call from a particular lady who had a concern about somebody who's at Charlotte Maxeke who's supposed to be discharged tomorrow, and this person could be HIV positive, but also the person is having multiple respiratory infections. One of them makes him to cough out blood. This could be a possible worst scenario of TB. It's a possible TB case. Yet, the hospital, they've got the nerve to want to release or discharge the patient before there is any medical stability to the family. What the family will do, they are putting the family and the community and whoever else that is going to be around that person at high risk of getting TB. What if the person could be having MDR TB, which is not easy to treat? But again, just recently, Treatment Action Campaign field workers did report that here, at Charlotte Maxeke, instead of now treating people with TB, they are transferring them to Begimlangin. Begimlangin is somewhere in Soweto, but still Begimlangin cannot handle the pressure. But also the issue of infection control is a problem. Even in Buitumelo, Sidibeng, recently, just this Friday, one of our field workers reported that patients with babies and children are squashed into one big, small room. And amongst them, there are those who cough a lot. So no one seems to have a strategy or care. There is lack of monitoring, there is lack of strategy, there is lack of better immediate response from even those who are in charge. It's not just political accountable people, but those who are general directors and everyone else. So there is lack of accountability and lack of care when it comes to TB.
Apart from releasing this report, have you tried to communicate these concerns that you've raised to government, and what has the response been?
Yeah, obviously, this is being communicated to the government, but because it's not just done in Gauteng, it's done nationally. Our national people and leadership have done that. But also as Gauteng, this is something that we're going to follow up, not just to the MEC of Health, who's the most accountable person in Gauteng, but to each facility that is implicated. Our branch members are supposed to go back to about 24 of these facilities that have been raised to have problems that are recorded as red, meaning they are a danger to the health workers themselves as well as to the users of the facilities. So at the level of the local level, our TAC members are going to go back there, but also we are going to follow up with the Ministry of Health as well as the Premier, as the head of the province, to say what is the immediate response. We do not want a long-term plan, want an immediate short-term plan in terms of how they are going to address this, and want this not to be done by them and be known by them, but it should be reported back to the stakeholders, to the communities. It should be publicized. It's not about, remember, it's about public, not about them. It's not how they respond, it's how the public is going to benefit from this. Yes.
You've painted a bleak picture, but is there anything that government is doing good in terms of fighting TB?
Yes. Time and again they do some advertisement on TV, like the one that when you cough you must put your shoulder like this. It's one of the good things that they do. Yes, time and again they go to the communities and do some form of education. Some facilities, of course, do understand infection control. They've got posters, they educate people through health promoters, they open the windows, and if they find that there are things that they can't control at the level of the facility, they created a separate space away from where there could be possible infections because of the squashing of patients. But it's not enough, because it's not about how good they do. It's about how people are able to not get new infections when they get to the hospital, and how those who are in the hospital or clinic get treated and get the kind of treatment that they're supposed to get. It's all about that. The good part, we're happy about it, it's okay, but it does not have a serious impact when many people could be exposed to TB infection. Yes.
Stephen Ngobo from the TAC really highlighting and saying that government really needs to do more in terms of fighting TB, fighting particularly new infections, and taking accountability for the way that patients are treated at these public hospitals. Michelle.
All right, well, thanks very much for that. eNCA Zikhona Tshona keeping her eye on the Gauteng province as we continue to track the state of public health care around the country.